Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics emergency medicine, affiliated with Henry Ford Health System and St. Joe Auckland at Beaumont. The theme of my health talk today is back to school safety for our children and adolescents and recent updates on immunizations. I have prepared a few slides that I will go through with our viewers, and then later on I will add some notes about the safety tips further. Since this is a great excitement for our parents, caretakers to send their children back to school after a long summer, our children are more likely to learn, thrive, and have a normal growth and development while they are at school with their friends. So there are following are some guidelines for American Academy of Pediatrics to follow regarding nutrition and good physicals of our children and adolescents. And later on, I will go about their immunizations. A well-balanced, nutritious diet, sufficient sleep during the nighttime, normal physical activity, a routine, thorough checkup by their pediatricians, and the basic immunization with the updates according to 2022 and more. Second slide. So what are some of the more safety tips? Children should stay home why if they are sick with flu-like symptoms, high temperature, shortness of breath, or any family members have any kind of COVID-related illness. Consider indoor masking for the immunocompromised, non-vaccinated individual. Frequent hand washing, personal cleanliness, maintain a social distancing, and be careful during the outdoor sports activity. These are some of the more safety tips. The role of behavioral medicine. Many children now are mentally depressed due to loss of loved ones, parents, caretakers, or their family, their friends during COVID pandemic. A proper referral to the mental health services, they play a significant role towards their healthy living. Furthermore, these days, sadly, there are firearm pandemics going on. Firearm safety, racism, hate, and bullyism are other major points to consider against the violent behavior. Social platform and texting should be discouraged during school hours. So now, after saying that, having said all this, there have been recent guidelines about the childhood immunization according to the American Academy of Pediatrics, updated February 22. Following are the updated immunization schedules for children and adolescents. And I have got the graphs for that instead of talking. So anybody can go log into their website and get all the information. The further slide is for the vaccination. For the immunization, the vaccines available right now from birth to 17 to 18 years of age. So these are some of the vaccines that are available, and before the kids get vaccinated at all ages, it is advisable that they should be followed up by their pediatrician. The pediatrics get a complete health evaluation, check them for the allergies and all that, allergy symptoms, and then be vaccinated. Very crucial to have this vaccination like from birth up till up till 18 months. And like the tabulated graph says, when first month, second of rotavirus, diphtheria, tetanus, acellular, H. flu, pneumococcal. And during some of these vaccines are repeated, and then some vaccines go up till the adolescent. During the adolescent annual vaccination, only one dose of influenza, and then I'm going to talk more in details about this in my handout. So these are further the childhood. This is, like I said before, very important to immunize the child between the first birth to 15 months of age. And these are the documented, tabulated form of vaccinations that an infant should receive. Again, these are all mentioned, the websites are in the bibliography. Okay, so now I prepared these 8 slides just to talk about this in summary. Now I just want to add a few notes that I prepared. So following are the guidelines for Academy of Pediatrics. Like I said before, students should have a nutritious meal, sufficient sleep, good routine checkup by the pediatrician, basic immunization, sports physical. What are the vaccines recommended? And I sent it on, I put it on the slides for our viewers to know. The vaccine immunization, there are certain websites that I put it in the bibliography. Now, I just want to mention here the influenza and the COVID-19 vaccine. They are highly recommended with the proper doses and the intervals. Now, American Academy of Pediatrics, they strongly recommend the COVID vaccination for all children 6 months and older. And so how do you differentiate with the symptoms if the child has flu or he has COVID? So these are some of the symptoms that go together: fever, chills, sore throat, generalized body aches, non-specific rash, muscle weakness. Now, the key point is that this could be the symptoms of flu. However, if somebody has some COVID infections in the family or the exposure, then they should be protected. So so children and teens, they should stay home if they are sick. Very important, because they don't want to go to school and give and spread their infection. Consider indoor masking for children for immunocompromised and vaccinated individuals, because a lot of individuals and the family that don't like to be vaccinated. Frequent hand washing, personal hygiene plays a very significant role towards protecting against any disease. Behavioral medicine plays a very significant role towards the post-COVID mental depressions among our children. Furthermore, these days, firearm safety, racism, bullyism, protecting kids against violent behaviors there are major issues that should be kept in mind by the parents, the caretakers of the children. So those are the bibliographies that I have included. Back to school safety from the pediatrics perspective, like when they go to the pediatrics office, the pediatricians, our commitments are to do a complete good physical examination, try to find out if there is anything abnormal on physical examination, a proper immunization according to the age, screening for hearing and vision, very important. Look for the developmental milestone on the child on the growth chart. Checking blood pressure and heart rate in details are very important before we sign for the sports physical form. Because a lot of kids, they go to the sports, they get involved with the contact sports and they have some issue going on. Very important, if I find anything abnormal in the heart rate, EKG is indicated. Similarly, the blood pressure and other vitals. Take another thing to keep in mind from the pediatrics perspective is to take care of any persistent infections or past injuries. If it is a girl, teenagers, it's always safe to talk about their menstrual history, any sexually transmitted diseases, and if there is any problem, always update to the OBGYN. So what are the role of the vaccines? What does the vaccines do to our body? They protect against diseases by producing antibodies in the body. Our immune system, they use white blood cells to fight against infection. There are 3 types of white cells we have in the body. The macrophages that fight against infection, lymphocytes that produce antibodies in the body, T lymphocytes that recognizes the particular germs to fight for. Vaccines are safe substitute for a child's first exposure to any kind of disease because the vaccine, they contain the same particles as in the disease, like an antigen. And the antigens stimulate the production of antibodies. I just want to mention here about the 2 new updated vaccines that are coming in or are already there. The Pentacell. Pentacell is an active immunization. The vaccine, this is an active immunization against diphtheria, tetanus, pertussis, polio, and H. flu type B. Pentacell is approved for use as the 4th dose series, just in a children 6 weeks to 4 years of age. Another vaccine out is Quadricell. And Quadricell is indicated for active immunizations against diphtheria, tetanus, pertussis, and polio. A single dose of Quadricell is approved for children 4 to 6 years of age. So here I have got a picture about these 2 new vaccines, and that can be projected. And the contraindications to vaccination, why we don't get vaccines, include severe allergic reactions to the vaccine, anaphylaxis, rash, and low-grade fever. So what are the most commonly used vaccines besides diphtheria, tetanus, pertussis? Chickenpox, which is also known as varicella, measles, mumps, and rubella, known as MMR, diphtheria, tetanus, and pertussis, vaccines against hepatitis and influenza. Now, a few footnotes I have mentioned at the end about the back to school safety. Before, like I said before the school starts, always discuss, have an open communication with the child regarding the bicycle ride safety, wear helmets, traffic, how you cross the traffic lights, the road safety, backpack safety, like the backpack should not be too heavy. They should have etiquette, pencils, pen, notes. During the school hours, maintain the cleanliness, frequent hand washing, and stay away from the kids who are sick. A previous notes I had prepared, the CDC guidelines regarding school opening, and this is on the vimeo.com, and nothing much has changed except that the people who are at lowest risk are when students and teachers engage in virtual only classes. The high risk are if the family has got some active, if they are more risk are students attending class together. The high risk if they have the COVID infection, in-person class activities, always maintain the school distance. Now, at the end, I like to thank our viewers for watching me on the Health Talk. There are certain vaccines that I have not touched, like the monkeypox vaccine, the COVID vaccines, and that will come in a second series of my Health Talk. I'd like to thank our viewers for joining me for Health Talk. The topic was school health safety and the proper vaccination according to the age. Thank you again.